There have been some changes to Medicaid in the last like month or month and a half or so. What that leads to is a loss in revenue for medical practices, right, and health systems, because they're unable to collect money from patients who otherwise wouldn't be able to seek that care without having some of those things. So having some of those conversations, is unfortunate, but it does lead to lost revenue for these healthcare practices, which ultimately brings down their budgets, which makes it harder to invest in certain products and services that they would need, and also just kind of hinders some of their kind of roadmap items that they have for the future also. So never a good thing to talk about, like when it comes to restrictions like that, but has been something that's been coming up a little bit more recently, just with the end of like the PHE related to COVID and everything else with that too. Well, essentially, if patients aren't meeting those Medicaid requirements, from what I know, it's right there, then they essentially have no insurance, right? So it's going to be harder for them to seek care at the facilities that they're usually accustomed to, right? So not only is that going to negatively impact the patient experience, but then it's kind of going to negatively impact the medical practice itself, right? Because they're not going to be seeing as many patients, they're not going to be making as much revenue. So that's something that's top of mind for folks, is how can we expand some of our services, whether it's telehealth or how can we have better conversion rates. So it's forcing people to kind of think more strategically and creatively about how can we again meet our bottom line.